Healthcare is a hot topic these days, and as consumers of healthcare, it can be a little confusing and hard to know if your doctors are all communicating and working together to provide the best care for you. We assume it happens, but how can we make sure that it's happening? Here to explain how it all works is Wesley Combs, president of the OnePartner Health Information Exchange. Thank you so much for being here. We appreciate it.
Glad to be here.
Yes,
Thank you.
of course. So I'm just going to ask you in general, what exactly is the Health Information Exchange?
Yeah, so you point out a great point earlier about we just think that the information is transferring. So we all know that hospitals and doctor offices have computers in them, and doctors usually look at the computer instead of the patient.
Right.
We understand that. Patients expect that information is flowing between all those computers when they go from one setting to another, and the truth is it really doesn't flow that way. And a Health Information Exchange is really what makes sure the data put in at the hospital or a specialty office gets back to the doctor that's really helping take care of that patient. So that's what a Health Information Exchange really does, is move that data.
Right, so everyone can see all the information in real time, which I think is so important. And so why exactly is this so important to not only our community, but the healthcare industry as a whole?
Right, so I think most people can relate to they're probably paying more for healthcare than they ever have. I think we as a country are doing that. And this right here is one way to reduce cost. We reduce duplication, we can actually make things more efficient. We actually pay a lot of people in the background to fax information back and forth. With the Health Information Exchange, we don't need to do that. And this also allows the doctor to really understand that you went to the hospital and now they can make a phone call like you would expect to say, oh, why were you in the hospital? Are you okay? Do you need to come in and see me? And that way they don't want you to go back into the hospital again, because that's probably not a great place. Most people don't want to spend time in a hospital. They'd rather be out at home or something else.
Right.
So I think it's a very important part of how healthcare works, is exchanging that data to get everybody on the same page. And a lot of medications, a lot of duplication. You can go one specialist and they'll put you on a certain drug that really conflicts with what your primary care doctor has you on. So overall, it helps share that record.
I was going to mention that, if you go to a specialist and maybe they see something, that's wrong, and then if you go back to the primary care, they can just look at the information that doctor has provided instead of you trying to explain and not knowing the medical jargon and everything like that, right?
Exactly.
Yeah, I'm sure that really takes a huge part of that puzzle out of play. And so today, how is that exactly being used, the Health Information Exchange?
So luckily in this region we do have a Health Information Exchange. Most of the country does not, but we have around 1,200 doctors that use this system daily. We actually cover 90% of the population in Sullivan County and Washington County, and then it kind of goes down as we go out from there, because this is the center of the region, and it's used daily. We actually have one of the highest utilization rates of any HIE in the country, even compared to the big cities. Ours gets used, and it's got a lot of value. I'll even consider some of that goes back to the fact that almost everybody that works on this thing and programs it went to ECSU. We've got a lot of local people that care about the local region.
Right, well, and I think that says a lot about the healthcare industry right here in the Tri-Cities, showing that a lot more people participate here than in bigger cities. That's an amazing statistic. And so is there something we as patients maybe can do to make sure that our healthcare providers are participating in this?
Yes, so it's really important when you go into an organization, you might see a OnePartner HIE sign on the wall. It's important to understand that your data is being shared securely with your doctors. And if you're at the hospital or somewhere, sometimes you have to mention to them that you want your information shared that way through the Health Information Exchange, because sometimes you have the option of not doing that, but the only people that see these records are people taking care of patients, right? And they're bound by very strict regulation and rules that the government set up, and we have a lot of stuff in place to protect for that. But it's really important to make sure that you tell your healthcare provider you want to share your records in OnePartner HIE.
Yeah, because confidentiality is key for sure. Well, Wesley, thank you so much for coming in. It was so nice meeting you.
Yes,
great learning all about that. If you want to find out some more information, you can just head to the website right there at the bottom of your screen.
The preceding portion of Daytime Tri-Cities was sponsored by